Secondhand smoke poses a significant risk for lung cancer, affecting even non smokers through involuntary exposure.
So, first of all, I would like to explain about what is secondhand smoke. So, secondhand smoke is involuntarily exposure to the smoke from the person who is actively smoking. Suppose a spouse is being exposed to the smoking of her husband. That is how secondhand smoke works. And it has been seen across various studies that it increases the risk of getting or developing lung cancer. So it varies from 30 to 50% across various studies. Person who are exposed to secondhand smoke are around 30 to 50% more risk of developing lung cancer as compared to a person who is never smoker or not exposed to secondhand smoke. So individuals like spouse, children, workspace environment, there are people who are smoking in workspace also. So person who are not smoking but they are exposed to smoker by second hand smoke, these are the individuals who are at higher risk of developing lung cancer. Mechanism is same as the mechanism of smoking related development of lung cancer. Same mechanism work in the person who is exposed to second hand smoke.
Protecting yourself from secondhand smoke is essential for reducing health risks.
So steps first and foremost should be that smoking should be banned, but I know that is not going to happen sooner or later. But one can step away from the person who is smoking, can distance himself or herself, so can go to different room in workspace environment, avoid those areas where people are actively smoking. For children, they should be away from the person who is smoking. One has to keep a distance from the person who is actively indulging himself or herself in smoking. These are the some measure, but yes, the crude one will be to put a complete ban on smoking, or at least it should be banned in workspace area. If a parent is an active smoker, he should smoke in an area which is not exposed to the spouse or the children. So these are the measures that can help a person to avoid being exposed to secondhand smoke. It affects everybody equally. Children, if they get exposure to secondhand smoke at an early age, so their duration of exposure will be longer as compared to elderly. But and also as the duration of exposure increases, chances of getting developing lung cancer are higher as compared to those individuals whose exposure is low. So the duration also matters, and also how proximity to the person smoking also matters.
Quitting smoking is achievable with the right support and resources. Here's how individuals can take their first steps towards a smoke free life.
So there are various programs going on for individuals who want to quit. So, there are various drugs available right now, and nicotine replacement patch, psychotherapy, cognitive behavior therapy. These are the basic steps that are available. One has to seek advice from an expert, and this can be very well conquered with the help of expert. So there are various individuals involved in this strategy. One is, of course, the primary physician, psychologist, and various NGOs. And there are various departments established in various institutions that are helping these individuals if they are really seeking to quit smoking.